let me see that model that you had for a second. So this is a picture of the shoulder joint. Can we zoom in on this, if possible? So we have a humerus bone, and we have a scapula bone, and where the two come together is a joint that's being held together by magnets in this model. In reality, there are no magnets, obviously, and it doesn't just stay there. Unlike a hip joint, which is to some degree more of a ball being encased by bone, this is something the size of an average human, the size of a golf ball, sitting in a teaspoon. But it's held in place by ligaments that come from the scapula, and a ligament is a fibrous tissue that goes from bone to bone, and it encapsulates this and seals it together. And actually, there's another lining in there that secretes a lubricating fluid. But the overhead throwing athlete, or the lacrosse player, or the athlete who just falls on an outstretched arm can tear the ligaments that hold these two bones together. That's separate and distinct from a damage to the actual cartilage, which we'll talk about in a little bit. In separating out the generations again, we'll come back to the athlete and how we fix that.
Sure.
Ligamentous injury. As you get older, damage can occur to the actual cartilage, which in this model is shown as blue. And it's not really blue, but to make it more distinct and visible, you're seeing it as blue in the model from the manufacturer. Let's talk about the more middle-aged to older people who end up with damage to the actual bone. And again, cartilage, let me regress just a little bit, is a Teflon-like coating that would be Teflon on a pan. God gave us a slippery coating on the ends of our bones that have to touch another bone, and that's called cartilage. And they cap the two pieces of bone that touch each other.